So what would you say in terms of the meals themselves? What is it friendly towards? Is it friendly towards only vegans, vegetarians? Does it, have meat in it? Dare I say it? Like oil, salt, sugar? Like what?
Absolutely.
Who is it catered to?
Yes. Well, it does cater to the omnivorous American.
Yeah. Can you give us an example of a typical meal?
Yes, I eat them all the time. We do have.
You don't have anything example to show.
We actually have.
So we are here at ACLM Orlando 2024, and I am joined by the lovely Dr. Jennifer Singh. And so why, how did Performance Kitchen manifest, and why is it needed? What gap is it filling?
What is this? Yeah. What do we do?
Yeah.
So I was amazed that I had been practicing lifestyle medicine for years and had never heard of this thing called medically tailored meals. In fact, when I first heard of it, this is a thing where healthy, nutritious foods are sent straight to patients' homes and paid for by insurance. I literally thought, well, that's a pipe dream. Like, that will never happen. This is something that we might have been waiting for decades. And those of us who've been preaching food as medicine forever, right? It is a real thing. In fact, there are millions of Americans who have Medicare Advantage or Medicaid in various states who have a medically tailored meal benefit, and they don't know it. Their providers don't know it either. So imagine these benefits just sitting out there belonging to patients who have diabetes and heart disease and other reversible or at least treatable illnesses who could be getting 12 weeks or more of delivered food to their home paid for by insurance, but they're not because they don't know. So our mission at Performance Kitchen is, number one, to manufacture just slam dunk delicious meals that can be
slam dunk
delicious, that are sent to patients' homes, that have the highest nutritional standards. Every meal we make meets American Heart Association guidelines for sodium, for saturated fat, and all the good stuff that you would feed your family anyway. We even sneak in vegetables that you can't even see.
Okay.
So these meals are shipped to patients' homes, but again, most patients who have an existing benefit don't even know about it. So we are passionate about awareness, educating providers, those of us who are in the food as medicine. We are already believers. Isn't it wonderful to have an easy button? All I have to do is simply know that a patient has a benefit, and I can activate it for them and immediately have fresh food sent to their house to help start this nutritional journey, right? The most difficult part is figuring out, as a doctor, do I have any patients who have this benefit?
Yeah.
Very difficult. So we've created a huge database of all existing medically tailored meal benefits in the United States. We've created 2 interfaces to help you, whether you are a patient or a provider, figure out, is this something I can tap into? Is this something I can use?
So it's like a resource that you can figure out whether the benefit is part of that plan or not.
Yes, because it's not Googleable. I mean, it would be so easy if I could just Google, does Jennifer Singh have a medically tailored meal benefit? A lot of people simply don't know how to dig through the large PDF of information that came with their insurance benefit plan, right? So we have one interface on our homepage that any healthcare professional or patient can use to put in basic information, including their zip code, any chronic condition they have, and their health insurance company, if they know. And they will receive a report back of a list that says, hey, in your zip code, it looks like there's 4 insurance companies that have benefits. Well, then I can at least recognize, hey, I have Blue Cross. I should call them and see if I have a benefit. We've also built a separate portal specifically for providers, for doctors' clinics. Now, as you and I know, most doctors are not going to be sitting down, hand entering patients into a portal because time, right? So we have several different ways that a provider can register for their own portal or have their office manager do so. And then they can actually batch upload lists of their patients to us. And we can help them see that, hey, look, out of the 100 patients that you just uploaded, 20 of them have a meal benefit. We're happy to help you activate that.
So what would you say in terms of the meals themselves? What is it friendly towards? Is it friendly towards only vegans, vegetarians? Does it, have meat in it? Dare I say it? Like oil, salt, sugar? Like what?
Absolutely.
Who is it catered to?
Yes. Well, it does cater to the omnivorous American who is unfortunately eating the standard American diet, but who is willing to dramatically upgrade their diet for a tasty and dietitian and chef curated alternative. We have over 60 meals that we offer, and the majority of them do contain animal products. This is for multiple reasons. The main being that as much as we as lifestyle medicine doctors and plant-based advocates want all of our patients to be 100% ready to transition to maybe a vegan or vegetarian diet,
not realistic.
They're not there.
Yeah.
What we have found is that serving them something with a degree of familiarity, especially including what are lesser than normal ounce servings of animal products, and those animal products being the highest quality that we can get our hands on, as a small portion of an entree that is then extra loaded with a fiber conscious background that is limited in salt, that meets American Heart Association guidelines for saturated fat, that doesn't have any artificial colors or preservatives, that emphasizes whole grains, no processed grains, no added sugar, only the highest quality oils when needed, always olive oil.
Just less ingredients for inflammation.
100%. So I have excruciatingly high, picky standards for nutrition.
Yeah.
But I was happy to align myself with a company that is so far above standard American diet. And I'm proud to say that every single entree we make meets AHA guidelines for cholesterol and sodium and saturated fat. We don't have healthy meals and unhealthy meals.
Yeah.
We do have meals, however, that are more appropriate for renal patients, so that have appropriate mineral and macro guidelines for renal patients. We do have meals that are more appropriate for diabetics. But for general heart disease prevention, weight loss or weight management, every meal we sell, I can stand behind.
Gotcha. And that's important because you want to be able to, there's so many different classes and types of patients that you want to serve. There's diabetic, there's a renal patient,
Yes, absolutely.
hypertensive. They all, on a granular level differ, right? So to be able to cater towards all that, but also nudging. I think that's one of the arts of applying food as medicine, culinary medicine, is really the nudging and understanding that everyone falls along a spectrum, right?
Exactly.
And how do we push them along
Yes.
towards this North Star
Right.
that you and I would agree, a low-fat, whole food, plant-based diet,
Yes.
but just inching, right?
Yes.
It's about inching.
And to be honest, when you circulate in the cognitive world of lifestyle medicine and plant-based nutrition, I find that many of us, myself included, we actually forget how far away it is from the standard American diet.
Yeah.
And that meeting patients where they are, revisiting the stages of change, you're exactly right, helping nudge them along from extremely fast food, extremely hyper-processed food, to an entree that, yes, may contain some animal protein, but is also contains beans and whole grains only and no added sugar. It's just a dramatic upgrade, and it's a very large nudge, actually, from where the standard American diet is.
Yeah. Can you give us an example of a typical meal?
Yes, I eat them all the time. We do have...
You don't have anything example to show.
We actually have... no, we're actually not allowed. We've tried and tried. We really wanted to offer samples of our food. We do have a coupon code for all ACLM members that you can order retail right off our site.
Okay.
And with a coupon code. So we do offer some plant-based meals. My personal favorite is the chickpea curry. It's just incredible, so flavorful. We have a masala greens, a masala coconut greens that's incredible. We've got a sweet potato kale bowl that's incredible. I do have omnivores in my family, so some of the favorites for my family. And I think it's interesting to say that as leadership in this company, we all eat the food that our company manufactures.
Good.
That's how firmly we believe in it. I serve it to my family. My family absolutely loves the chicken mole. And one way that we love to use some of the meat-based entrees is to actually add corn tortillas and a salad and vegetables and take what was, honestly, only probably 3 ounces of meat to begin with, but use that very much as a condiment and spread it out. It's almost like becomes a meal starter, right? As we enrich it with more vegetables. And it's really fun to educate patients how to do a meal like that also.
And introducing concepts like protein flipping and, just like reversing engineering how we think about a healthy plate. Right. And it's about that nudging. So I think you're doing great work.
Thank you so
much. Yeah. Keep up the good work.
Thanks.